Hi, y'all. My name is Katie Mae Pitzel. I wanted to tell you I went to the doctor today, and I told him that I was waking up in the middle of the night, all sweaty. My pajamas were wet, my bed sheets were wet, everything was all soaking wet, and I was beginning to think I had a problem with my bladder. Thought, oh Lord, everything was all soaking wet. But then I realized I was having those personal tropical storms. He said I needed to take something called Premarin. Premarin is the brand name for a group of conjugated estrogens or hormone therapy. There is no generic name, and I said to him, that sounds kind of expensive. I need a generic. He said, there is no generic. I said, I will take it, but I need to find the least costly method to be able to afford this medication. He said, if you go to Premarin.com, they'll give you coupons. He said, there's a company called Pfizer that will help me out with these coupons. Then doctor went on to tell me that the main ingredient is from horse's urine, pregnant horse's urine. Can you believe that? The nickname for this medication is called pregnant mare's urine. What do you know? Then he showed me this, and I said, oh my God, there's this list. Sodium this and sodium that, sodium these ones. All these combination of things make up the drug called Premarin. He told me it's available in tablets, cream, or injection. I said, Lord, I ain't getting no shot. I don't want a shot. So he said that he would make sure that I received the Premarin medication in a tablet form in the least amount of medication possible, and it would be at the lowest therapeutic dose. Amen. I said, okay, I'm down for that. He went on to tell me that what I was having, that I call my personal tropical storm, was hot flashes. I said, oh my God, I'm as hot as the sun and dry as the desert. He said that vaginal dryness could be another indication that I'm in menopause. I need this Premarin. He said this medication will help me all kinds of things, and it does help people with other kinds of conditions. It can be used to treat the osteoporosis. I'm down with that. He said it can be used to treat the prostate cancer, but I don't have one of those. He said it can be used to treat breast cancer. I said, dear Lord, I hope I don't have that. But the doctor said that since I've not had a hysterectomy, I might have to take a second medication. But we won't get into all of that, because I'm intrigued about this pregnant mare's urine pill. Pregnant mare. Oh. He said that the benefits of the medication are that it could actually prevent me from having a UTI. I said, well, what is that? He said a UTI is a bladder infection. He said not only will it do that, but there is something called urogenital atrophy. Something about things shrinking down there or shedding. I said, well, I don't want none of that. He said it will prevent that, and it will prevent the osteoporosis. Sometimes it can help with blood sugar control and retaining my teeth. I said, oh Lord, am I going to lose my teeth? It sucks getting older, but apparently I am. Most of all, it will help me from my PTS, personal tropical storm problem, and that is exactly what I need. Those storms drown me in the middle of the night. He says it's common to get those hot flashes in menopause. He said that if I have 7 or more personal tropical storms per day, that Premarin is right for me. It's recommended. He says I will use these little tablets in all these 0.something milligrams, or even up to 1.25 milligrams, for the shortest amount of time necessary to help me with my symptoms. The wetness, sweatiness, can't sleep. After he reviewed all the risks and benefits, I said, dear Lord, isn't it risky enough getting older? I said, is there any other reason people take this drug? He said, well, It manages symptoms of decreased estrogen in the body as you enter menopause or if you have another hormone-related type disease. So, to minimize my menopause, my PTSs, my night sweats, my insomnia, I should take this medication. The fact that I could have bone loss and osteoporosis, I might even have some cholesterol problems due to menopause. I've been watching that. He says I should take this medication. He says that it will also minimize the potential for vulvar or vaginal atrophy, which is another part of this menopause guy. I said, how do you know that? He says it's a known fact. I said, well, let's try to prevent it. Doctor said I may want to watch out for some side effects. I might feel the nauseousness. I better take it with food so I don't get the nausea. And that while taking this medication, I could commonly get abdominal pain, back pain, breast pain, headache. I might even get depressed or gassy. I said, what is the point of taking it then? He said, get rid of my personal tropical storms and get a good night's sleep. I said, I'm down for that. I asked, I said, have you told me the possible side effects or just the risk for taking this medication? He said that if I have an existing breast cancer or other types of cancer, he can't give me this medication. Could be risky. He also said that if I get the headaches, it could increase the risky for getting migraines. I might get a funny brown face, and change my color. And if I have the gallbladder or liver disease undiagnosed, I'm bound to be yeller. The jaundice. I said, oh, wow. There's a lot to think about. There are some other things that I need to know that would mean I should not take this medication, such as if I was pregnant. I said, oh, Lord, I ain't having any more babies. He said if I was allergic. I said, well, how would I know? I've never taken that. He said if I had vaginal bleeding that he did not know about, I better fess up now. He also said that if there's a cancer that I have that needs estrogen, it's like adding fuel to the fire. And when I take Premarin, it can get bigger and stronger cancer than it ever was before. That pregnant mare's urine pill, oh my God. There's some other warnings he said I need to know about, such as if I had a history of cardiovascular disease. I said, cardio what? He said any severe hepatic or renal disease, if I had asthma, bronchitis, any bone disease, and I told him about migraines or seizures, and he said, no way to Premarin if I had any of those. If I had breast disease, I ain't going to get that medication, Premarin. He asked me about breast disease, and if I had it, and I said, nope, I ain't going to get that medication if I do. He said, did I do a self-breast exam? And I said, well, no. He said, well, you better do that if you're taking this medication. I said, they may be hanging low, doctor, but I don't have no breast disease. He also said that genital tract cancer can be common in some folks, and they may not even know it. That's a warning if I ever had one. Better get that checked regularly. He asked me about any cervical or vaginal kinds of cancers down there, but I've never had any, Lord have mercy. If I was breastfeeding, I couldn't use this medication, but I ain't doing that. Then his nurse popped in. She said, Katie May, you better avoid smoking. Quit it altogether. You better exercise regularly, and you better decrease the amount of saturated fats you eat. No more downtown pizza for you. And again, I'm supposed to take this medication, Premarin? Well, I'll take it. I'll take it with food so I don't get nauseous, I reckon, because that's the most common side effect. The nurse said, also be sure to tell doctor if I've ever had asthma or low-protein CRS. I said, you know what? I don't even know what protein CRS is. She said, then you're in the clear. Because if I did have it, it would increase my risk for blood clot, stroke, heart attack, pulmonary embolism. And I said, pulmonary what? Nurse said, it's a clot that forms in the lung with too thick blood with pancake-like syrup blood type. I said, whoa, that's complicated. Well, then the doctor comes back in, and he says, don't take the ginseng. I said, well, Dr. Oz, I watch him every day. I love that man. He says, Katie May, take the ginseng. Doctor says, don't take it. Don't take any over-the-counter herbal, vitamins, supplements. He said, do not do it without cussing with him. I said, Lordy, doctor, I won't cuss with you. I said, I love you. Doctor also talked about some adverse reaction while I was there, and I said, oh, Lord, not any more bad news about this Premarin drug. Sounds like I couldn't take any more of this. I felt it. He said it's possible I could have this pulmonary embolism thing, or bronchitis, upper respiratory tract infection, stroke, heart attack, pancreatitis, liver failure, cancer tumor, and an increased risk for developing cancer or even a rash if I take the Premarin. Worst of all, he said I might get more hungry. I said, I'm already hungry, doctor. I eat all the time. I can't lose any weight. He said, finally, Katie May, get off the wart. My wart? I've been taking my wart for so long it makes me happy. He said, no more St. John's wort. That's another type of supplement. It'll mix with the medication and no good. He said, if you're taking seizure medication, Katie May, or thyroid medication, don't do the Premarin. It can alter the efficacy of these drugs. But I ain't taking any seizure medication. He won't be testing my thyroid while I'm on Premarin because it would alter the results of that test too. Don't take the erythromycin, clarithromycin, or something called ketoconazole because it will increase the therapeutic level of the Premarin and possibly increase the side effects. He ended up reminding me that if I get vaginal bleeding, I gotta come running and tell him, and I should be cautious about thromboembolism or something like that, meaning blood clots again. So if I get some funny feeling in my legs, they get extra cold or even extra hot, I need to tell him right away. I asked him, do the children take this medication for any reason? He said he knows of some cases where there's been some baby girls that have had problems with their parts down there, and they've had to take the Premarin cream to progress their development, but other than that, it's not used in children normally. He said something like that could be an indication, but he's not going to get into all the others. I said, oh, doctor, dear Lordy, thank you so much. I'll be on my way to the pharmacy for this prescription-only medication. Thank you, doctor, and you have a great day.